Question number 2. The nurse is preparing to hang a unit of packed red blood cells for an alert-oriented, hemodynamically stable patient experiencing bleeding of the GI system with a hemoglobin level of 6.3 and realizes there is no signed consent. The nurse's best action is to administer the blood, A, because this is an emergency situation and the consent is implied, B, after the provider obtains informed consent, C, as long as the patient verbally agrees to receive it, D, because the admission consent to treatment is a blanket consent for all care related to the admitting diagnosis. So the correct answer is B, after the provider obtains informed consent. Although this question uses hematology concepts, the category for this question would be a professional caring and ethical practice question, since informed consent is an important ethical principle in healthcare. This patient does need the blood transfusion, but given the assessment that the patient is alert-oriented and hemodynamically stable, this situation is not an emergency. So there is time for the provider to discuss the risks and benefits with the patient and gain their written consent. Verbal consent is not appropriate, and the blanket consent to treat does not cover blood transfusions because blood transfusions have their own risks and benefits that need a separate consent.